Welcome to Glow Social Club, the space where powerhouse women come to reclaim their health, their clarity, and their leadership. I'm Jazmine Corona, functional nutritional practitioner and founder of Organically Glow and Glow Social Club. Around here, we don't do one-size-fits-all advice. We translate symptoms into strategy and build the kind of structure that actually sustains you. If you are ready to lead your health, your work, and your life with clarity, confidence, and conviction, you are in the right place. Let's begin. Hi, Christal. Welcome to Glow Social Hour. I'm super excited to have you on.
Yes, I'm super excited to be here. Thank you for inviting me.
Yeah, of course. So before we jump into all the things about weight loss and hormones, I really just want to hear more about your journey and how you even got into this work.
Yeah, so I'm Christal. I'm a nurse practitioner here in Southern California, and I opened my practice after being an ER nurse for, I believe I was about 10 years in at the time. And just, as we all do, got burnt out with doing ER and just trying to think of other things that I can do. And I heard about, initially I heard about people doing IV hydration, like on the outside of the hospital. And I could do that with my eyes closed because I did it at the hospital all the time. So long story short, ended up going down the rabbit hole, figuring out how to open my own IV hydration business. And I opened that in the end of 2019. I also had just had my first daughter, and was on maternity leave, just figuring out how to open my business. So ended up doing that, and just it kept growing and evolving, adding different services on. And the first idea was to go into aesthetics, so Botox and fillers. I was doing all those things, and then ended up going to a conference, learned about hormone therapy, which I didn't think was for me. But when she started listing off everything that the symptoms of it, I realized that my hormones were out of balance. And now looking back, most likely because I had two babies back to back, was going through postpartum, I was older, geriatric pregnancy, as they say, when I had my baby. So everything was just going haywire, and ended up balancing my hormones, learning more about it. And I just felt amazing after that. So I'm like, I have to start doing this for my patients. So just started talking to my patients about it, and ended up getting into hormone therapy and weight loss and loving it so much that I switched my whole practice. So I no longer really do Botox and fillers only for, old clients or friends, but now I mainly specialize in hormone therapy and weight loss. So got into weight loss again, helping myself, trying to lose weight, and just hormones again, out of whack, like sugar cravings like crazy, all the things. So ended up fighting about medication. That's when the GLP-1s were coming around. Then I thought, okay, well, let me try them for myself before I try them for clients, and ended up learning a lot in that short period of time that I was on the medication. So learned a lot about it. Eventually ended up then getting hired on as a nurse practitioner at the hospital I work at to do strictly weight loss. So got to get to still see a lot of patients, walk them through how to use the injections. A lot of them are scared. So that has been very fulfilling, and then brought that over also to my practice where I do hormone therapy and weight loss as well. So that's kind of how, I got into this field of medicine.
Amazing. I love hearing I feel like so many women, we go through our own health challenges when it comes to hormones, energy levels, mood swings. And it's so interesting because once you go into that journey and you have your own health struggles and you find a way out, you're like, okay, my whole life has completely changed. My whole perspective on everything has changed. So now what do I do with this information? You know what I mean? And of course, like as just natural healers, just in personalities and, as a nurse practitioner, like you got into that job to really help others. And so once you find something that helped you, you're like, okay, we're doing this, we're trusting this, and we're going to bring this to every other person that is experiencing the same thing. So that's so amazing. I love hearing that. This is where everything's going. This is where, the future of medical care is going, of just preventative care. So I'm super excited to just chat a little bit more about the GLP-1s and just your journey with them, your experience with them. This is something that is such a huge, huge topic right now. It's all the rage. And it's so interesting because, of course, in the medical field, right, in the medical system, they're, kind of promoting GLP-1s and these weight loss medications as a one size fits all, right? This magic potion, this magic pill. And then in the health and wellness space, it's like 50-50, right? We got 50% of the health and wellness influencers or just people who are the enthusiasts who are like, oh my gosh, yes, I love this. Like it's making such huge changes for my clients, for myself. And then the other 50% are like, no, stay away from it. You know, this is terrible for you. It's going to, you know, destroy everything in your body. And so I find that so just so amusing, honestly. And it's also so overwhelming for clients because they're like, well, who do I trust? You know what I mean? Like I have this person who's like, oh, raving about it. And then I have this person who's like, this is destroying your health. You know what I mean? So I really want to hear your perspective on GLP-1s and just your experience with them.
Yes. So there's so much to unpack. With the GLP-1s, I know it does get a bad rep in the media. And I always say a lot of that is from people who aren't being managed properly while they're on the medication. Because, you know, I have clients who are taking it as that magic pill. They're still eating whatever they want. They're still having the same lifestyle habits, and they can be on it and lose like 5 pounds and wondering why. Well, my sister's brother's niece-in-law's cousin lost 100 pounds. Why am I not losing? So I think having a practitioner who can really walk you through how to properly take this medication while also working on lifestyle is very important. The medication, just with studies alone, has shown that the medication does have amazing effects. Of course, not every medication is for everybody. There are certain contraindications where people who, depending on their medical history, cannot take the medication, such as if they have history of pancreatitis or a certain very specific type of medullary thyroid cancer, they cannot have the medication. But it is doing amazing things with people, I feel like, when it is closely monitored. So, you know, there is such a thing that of these super responders. So people who are on the lowest dose and they're just losing rapid weight. And with rapid weight and not eating comes the hair loss, comes with losing muscle while you're on the medication. Or, you know, a lot of people are still in this mindset of cardio, especially as you get older. Cardio is not the most effective exercise tool that we have, especially being on a GLP-1. You want to focus more on strength training. So just having someone to walk you through those things, I feel like gives patients a better chance on the medication with less side effects. So again, back to the research, the medication itself has anti-inflammatory properties. So not only being used for weight loss, but it's being shown to, you know, decrease inflammation in the body. It's been shown to help people lose weight, which helps with sleep apnea, which is a whole cascade of issues that come with people who have sleep apnea. Most people don't even realize that they have sleep apnea. But the medication is also helping to decrease cholesterol in the body. It's helping with heart disease now. We know it helps diabetics. So I do feel like, again, with the proper care and somebody to walk you through is really what gives you an advantage of being on this medication while you're taking it, to mitigate a lot of the side effects. So hopefully that answers your question.
Oh my goodness. No, thank you so much. That's what I love about you, because you're just so transparent. You really understand the medical side, right? You know the science, you know the research, but on top of that, you know how important it is to actually provide that support with patients and clients, right? You are really not just focused on, here, take this medication. You're focused on, hey, this is amazing, right? This is going to absolutely change your life, but you also have to do the hard work with, you know, changing your diet, really focusing on your lifestyle and using that combination. Not a lot of people do that, right? Especially in this space. So many people, like I was saying before, like they're just so focused on, just take this pill, it's going to change your life. And they forget about this other side of diet and lifestyle. And then the patients are so frustrated and so angry because they're like, hey, I'm supposed to be dropping 20 to 50 pounds, right? Like I'm only losing 1 to 2 pounds, and what's happening here? And they just think it's a magic pill. So I really do truly believe it is so important to not only talk about these GLP-1s and how fantastic they are, but also really bringing in the lifestyle and the diet into that, right? Because that is that's where the long-term changes happens. That's where the long-term transformation happens. And that's what we're really focused on, right? Or that's at least what we're both focused on. I don't know about everyone else.
Right.
So that's what I love about you and how you really practice with these. But just going off of what you were saying about, you know, the diet and the lifestyle, you said that also it's so important to start building muscle when you're on these medications. And that's a big thing that's happening right now. People are finding out that, hey, like I've been taking these medications for over a long period of time now, and I am losing so much muscle. They're even talking about now the Ozempic face, right? Like you're just super slim in the face. So can you chat? Yeah. Can you chat a little bit more about that and like what they can do to kind of combat those side effects?
Sure. Yes. So I always like to keep my patients in mind of the long end. And with Ozempic or, GLP-1s, I always say that you kind of build a relationship with it. So they don't really understand what I'm talking about at first. But then when I see them for the follow-up, they're like, oh, I understand what you're saying because, certain foods you eat are going to either keep you constipated or send you running to the restroom. So you'll know that you cannot eat those foods. Also, so the medication really does do a great job of filtering out or quieting the food noise, which a lot of people don't know that they have this food noise. They're, eating breakfast, already thinking about what's for lunch or thinking about what snacks they can get into. And we really don't realize how much that food noise is there until it's not there. So recognizing that, I always tell patients, and this has to do with keeping the muscle on as well, but having patients to make sure you're eating. If you feel nauseous, it's most likely because your blood sugar is dropping and you're not eating. So making sure they eat, making sure they are getting at least 30 grams of protein per meal in. So, showing them what protein looks like, what kind of protein snacks that they can have, how to ensure that they're focused on protein. That's going to keep the muscle on. I also tell patients to be mindful of their hunger cues while on the medication. So when you're taking the medication, it's where you're eating and after, probably half of what you normally eat, you just get this feeling of like, that's all I could explain it. You're just like, I cannot eat anymore. So noticing what that feels like, noticing the hunger cues when it happens. Oh, I'm full. Let me stop. When you start doing that now, when you kind of have that instinct in you that just like it forcibly makes you stop. Some people eat over it, and those are the people who don't do so well on medication. Yeah. But if you start to learn those hunger cues to stop when you feel full, that's going to be helpful when you get off the medication and you don't have that sense that's making you stop. You can easily overeat, but I tell them your stomach is going to shrink while you're on this medication because you're eating less. If you get off of it and you continue overeating, it's just going to stretch right back out and you'll be back to eating, I always use tacos. You'll be back to eating those 3 tacos. So I tell them to notice your hunger cues and then also start noticing your portions. If you know that on this medication, you can only eat 1 taco and that your stomach can only handle 1 taco, stop ordering 3. Because once you get off of it, you're going to go right back to ordering 3 and then you're going to gain the weight again. So those are a few things that I tell them to be able to help them keep their appetite up, that they're at least eating food and that they're not losing muscle. So the other thing, again, is going back to strength training. A lot of patients and clients will tell me, well, I walked my dog today, and like that's not really exercise. It's a concerted effort to exercise, not just what you do on your normal basis. So definitely the strength training, I tell them cardio maybe 2 days, but the 3 days is strength training. So I don't care if you're on the couch lifting some weights or if you're pushing some weights with your legs, if you have bad knees or bad this, you have to do something to build that muscle, to keep that muscle, because not only, and this, but I'll just say, also focusing on strength training allows you to burn more calories when you're at rest. So that is another incentive to strength training. So just really trying to enforce keeping their protein up while they're on the medication, eating their protein first, eating in that wheel, like eat your protein first and then your veggies and your protein, and then go to your carbs. So just trying to correct the nutrition ways. And sometimes when at the hospital, and that's another thing about modern medicine, at the hospital I have 20 minutes to get all of this in. It's very hard, and that's another reason I opened my own practice, because I have an hour here with my own patients to be able to explain this ad nauseum to them and see how important it is. But I still really try to get those notes into patients so that they know how to be mindful and also what foods to eat to keep the muscle on while they're on the medication, so they aren't getting Ozempic face and their skin isn't all flabby and things when they get off of it.
Oh, thank you. See, you're just a wealth of knowledge. I absolutely love that. So just going back to building a relationship with it. That is something I
Yeah.
have never heard. And just your explanation of it is so right on. Like that is perfect. Building a relationship, you're
Yeah.
really teaching clients to be more aware about their
Mhm.
body.
Yes.
And that is something that in our society I feel like is just lost. We are so disconnected from how we feel or
Mm.
what we even think is like, oh, I feel good. Like we don't know until you actually start feeling good and you're like,
Mhm.
oh my goodness, this
Yes.
is how I'm supposed to feel. Like I'm not supposed to be napping halfway through the day. I'm
Yeah.
not supposed to
Yeah.
be, feeling nauseous after eating or, feeling extremely bloated. Like it's
Mhm.
so crazy, but building a relationship with not only with, while you're on the medication, but with your own body is so
Mhm.
important because you kind of learn what works, what doesn't work. Okay, like when I'm on this medication, like this is how I feel when I'm eating the one taco, right?
Mhm.
If I'm
Mhm.
full, then when I'm off the medication, I should probably only be eating one taco. So it's
Yes.
really, again, like you said, like you're really learning how to build a relationship while on this medication. And so
Yes.
that is something that, again, no one is talking about. No one is talking about, the benefits of actually using these GLP-1s, but also in the combination with the fitness, the lifestyle, and the
Mhm.
diet. So thank you for sharing that. I really, really love that. And then with just going back to this food noise,
Mhm.
again, you said that not everyone realizes that we're constantly thinking about food. And especially in our society, right? We're driving down the street, there's a McDonald's on the corner,
Mhm.
there's a Jack in a Box, there's Del Taco, or,
Yes.
whatever you see, there's so many
Everything.
fast foods. And you're constantly thinking, like, oh, that sounds good. Or, oh man, maybe I'm hungry. Or even if you're out and about and you just ate like an hour ago, but you
Mhm.
you smell something, right?
Yeah.
And you're like, okay, maybe I can just have a little something right now and I just won't eat in a couple hours. Can you just talk a little bit more about that food noise and really like what do you think is behind that? Like do you really think it's just our society and what we kind of have built in us, or
Mhm.
is it something that we can turn off without the medications or even with the medications?
Yeah. So with the food noise, I think it's a little bit of both. I think we just get so accustomed to, like you said, just seeing different foods and smells, and then just wanting what we want. And then there's the other aspect of the emotional eating part, which is a lot of what we have to, what a lot of clients experience, and just kind of be mindful of that, like why we're eating, why we want that, those things. So, with obesity, we have to remember that, if someone is truly obese, has obesity, like it is a medical condition. And I think a lot of times people forget that, and there's just so much stigma around weight, and that's a whole other topic. So, but with true obesity, it is shown that, there is this food noise, and there's just this constant, like, kind of obsessing over food. And I believe the medicine gives you kind of a break from that to be able to realize that it is there, but it can be shut off, right? So once you realize that it's gone, and then once it comes back, you have to really, I guess, like, fight with yourself or just be mindful that it's there and learn the tools to be able to manage it. So I think that is what, another good thing about the medication is it allows you to not think about it. So then you can see how much you do think about it. And then also using the tools, or being, again, it comes down to provider who, if you find one to educate you about these things, but to be able to fight, like, why am I feeling this? Am I really hungry? Being able to stop yourself, and to really check in with yourself to answer those questions before you continue. So it's a lot of mindset work, and that's what I just feel like the medication kind of gives you a breather to do. And it's funny because I'll have patients come back and they'll say, I noticed this, and I'm like, yep, that's exactly what I say. So some people notice it, and some, others don't. So I think that the food noise can be very distracting. Again, and another thing about the medication, and this is a whole other topic too, is a lot of those who are obese or struggling with weight, especially older clients or my, older, when I say older, I mean like those who may be going through perimenopause, 40s and up, there's a lot of insulin resistance going on, a lot of insulin insensitivity, and those things can keep you in a constant, crave for food and sweets and snacks and things like that. So another good thing about the medication is kind of, is getting the insulin sensitivity, resistance in line so that your body isn't craving those things. So I try to have patients to realize that, I tell them, look up insulin resistant foods or insulin sensitivity, like look that up, see how you go about eating and keeping that in order so that your body isn't craving all of these things and having all the constant food noise. So again, I think the food noise is something that is definitely there, but making people aware of it and how to manage it really goes a long way, again, with using this tool as a resource of medication. So most, weight loss, and I tell clients too with weight loss medication and diets, all it is calorie restriction. So the injections, of course, deal with more hormonal things. So I will say that it does a lot more than just restrict your calories. But with most diets and things like that, which diet is the best? It's really just about restricting your calories, eating within your calorie deficit. A lot of times I'll have clients too with just going back to food issues and the food noise, they'll be like, I was really good on the weekday, but I do tend to cheat on the weekend, and I start having them count things and seeing, well, if your insulin again isn't stable during the weekend, then you're overeating all the calories that you saved during the week. So just being mindful of those things and kind of keeping your insulin so where it's not constantly spiking is what's going to mitigate those cravings for sugar and also the food noise, because you'll feel more satisfied throughout the day.
Yes, yes. And you just that point of going back to the metabolic health, right? Because that's really, I feel like that's the root cause behind that food noise, right? Our bodies are so intelligent, they're so smart. And so if we are not providing it with what it needs, and we're constantly in the back of our head, like, hey, we need to be eating, like, what is going on? And then it's also up to you as a person to really, and then of course, us teaching our clients what to eat, what not to eat, and what's good for their bodies, but really learning how to nourish your body with the right foods at the same time is really, like you said, it's going to make you feel more satisfied. When you're satisfied, your blood sugar is good. When your blood sugar is good, your mood is stable. And it's just a trickle effect. It really just impacts every single thing in the body. So yeah, that's amazing. Yeah. I love those tips. It's something that we really do have to be mindful about, because our mental health is so important. Our mindset is so important when it comes to a healing journey in general, right? And it's so interesting too, because, I like to talk about, the mental health side. I really like to talk about the mindset work too, because it's so important. And the people who actually see results are actually realizing and being aware of their lifestyle, their habits, their changes. And then on top of that, introducing these amazing tools such as GLP-1s to kind of help them get over that hump. So it's really so amazing what these GLP-1s can do. And I just really last question is, I just want to kind of understand from your perspective, like, who's a good candidate for GLP-1s?
Yes. So I honestly think those who are good candidates are those who are ready to do the work and to not just use the medication as just like, as we keep saying, a magic pill, because you'll find that you can be on it and not lose weight. Those who are ready to do the work as far as their nutrition and things like that, I feel that, a lot of times people have been yo-yo dieting and things. I do think that the injection is good to give people results for their actions, because it is frustrating, especially if dealing with the audience that I service, which is mainly, again, those who are starting to be in perimenopause. So there's a lot of fluctuations going on. They're just frustrated, not only with their weight, but just all the other symptoms. So it's good to have this medication, again, use it as a tool so that they can see some results for their actions. And then I feel that motivates people even, to continue going and continue trying and using the tools that I'm giving them to really see the weight loss. But I feel that it's a good add-on for those who are ready to do the work and ready to just institute new tools and new ways of eating and living and being with this medication, but also using it with the end in mind, that you're not going to be on this forever, and that you're really going to work on the mindset while on this medication, so that you can use these tools to get off of it. Because I myself, when I took it for 5 months, and I lost 40 pounds in those 5 months. And then I started at the same time when I was getting off of them, that's when I started doing my hormonal work. And I just feel like with my hormones balanced, I still feel like I'm almost on the injection, because my appetite has not gone back to what it was before. I don't have that crazy sweet tooth. I'm definitely using those hunger signals when I'm full. I definitely try to stop, definitely try to definitely get my protein in, definitely try to eat protein first. So just using those small tools has allowed me to keep the weight off. That's another question I ask, or people ask a lot. Like, once I started, is it true that I can't get off? And that's absolutely not true. But again, if you don't institute those healthier ways of eating, then you will gain the weight back. And it's not because you stopped the medication, it's because you went right back to those poor eating and lifestyle choices that you were doing before, because you can be successful off this medication. I will have a lot of patients who come back and they're like, hey, I plateaued. Can I switch to another injection? And I'm like, no. Let's see why you plateaued. Are you working out? Mm-hmm. Well, no, I got to start. I'm like, yeah, you have to work out, because your body, no matter what drug you're on or just doing it just off of diet and exercise, you will hit a plateau, and you just have to push your body a little bit harder, because your body wants to be at that set point and it's comfortable there. So you just have to do a little bit extra with it. So yeah, I think those who are have tried everything and they maybe need that little extra push to get them over that hump are good candidates. Of course, those who have a BMI that at least over 30 can benefit from the medication. But yeah, a lot of people can benefit from it. But also, again, if you want to continue or just think you're going to use it as a magic pill, you're going to most likely end up sick because you're going to eat the wrong foods, and it's going to constantly have you, if I have patients who've been on it for 3 months and they're still getting nauseous, I'm like, what are you eating? Because now it's a lifestyle. Your body has gotten used to the medication, should be by now. It's probably something that you're eating that is not agreeing with the medication, and it's causing those symptoms. So you really have to do the work while on this medication to make it successful and to mitigate a lot of the side effects that can come with it.
Yep. Nope. Everything you said, 100%. Like, that is, it's a combination of everything. And I'm going to keep saying it over and over again. You just can't take the medication. You also got to do the work, And that's the most difficult part, but it's also the most rewarding part too, because you absolutely just transform your whole life. Yes. So one last thing, I just want to hear from you. What's the one tool, item, or hack that goes beyond mainstream medicine that has absolutely transformed your life, your health, or your business?
Ooh, that's a good question. I would say it's has been really pertinent to business too, but can definitely transfer over into life. And that's just not being afraid to pivot. And so again, opened this practice with IV hydration and built it up with Botox and fillers. And I almost feel like I had to start over a year and a half ago when I was like, I don't want to take any more Botox clients. Like, I'm just going to start saying no, but being so afraid to do so, to make that pivot. But once I did it, like, the anxiety went away. My practice started thriving because, again, while Botox and fillers are cool, love them. It's not something that I do all the time or have to do, but like these hormones and my diet and fitness and lifestyle is like me. So I can sell that all day, every day without even trying. So I think if you truly find something you're passionate about, but it's against or different from what you were doing before, and even with like lifestyle and being your own advocate for health, like, don't be afraid to do those things, the things that will make you happier in life. And it can definitely change your life. And is probably the thing that you need to do. It is the thing you've been scared of the most is probably the very thing that you need to do. So I would say that was a good question.
Yeah. Thank you so much, Christal. I am so excited we did this, but just please share where everyone can find you on social media or anything new that you have coming out too.
Yes, so I believe it's all platforms now. I am Christal P, the hormone NP. So that was another one. I was Christal P, the beauty NP, and even changing my Instagram name. I was like, oh my God, am I really doing this? But it's Christal, and Christal is spelled Christal, P as in Parker, the hormone NP. You can find me on all platforms there, and just message me or reach out if you guys are interested. And again, I do hormones. So if you are someone who's struggling from mid 30s and up, struggling with, fatigue, brain fog, of course, hot flashes, night sweats, mood irritation, those are definitely could be reasons that your hormones are unbalanced. But of course, like Jazmine, we always look into total lifestyle, because even with the hormones, if I fix those, but you're not sleeping, you're still going to feel crappy. Or if you're, if I fix your hormones, but you're still, not eating nutritious, you're going to feel horrible. So it's a whole lifestyle, and it's really getting the lifestyle in order so that you can live an amazing, amazing life.
Oh, awesome. So I will leave all the information too, and wherever we put this on. Yeah. And then on top of that, I just want to say thank you again for, coming in and chatting with us about all the GLP-1s, your journey, all the things. So I'm very excited to get this out to the world, honestly. Yes, so let's change lives, and make sure you guys mention Glow Social Hour when you guys reach out to Christal.
Yes, please.
But other than that, yeah, we are done. Yay. So we'll see you guys next time.
Bye.
If today's conversation shifted something inside of you, if it brought you clarity, relief, or a new way to see your health as a leadership tool, I'd love for you to share this with another powerhouse woman in your world. And remember, symptoms aren't the problem, they are the signal. When you start translating them, you stop surviving and you start leading with clarity. I'll see you next time inside Glow Social Hour.